Jason Foster was born with an intellectual disability and had epilepsy and diabetes. He lived at residential facility Minder, where his mum Diane Badman says he fostered a passion for crafts.
Never made a mistake, or if he did, he went back over it again, so it had to be perfect. It's one of our very special keepsakes.
Yeah. In 2011, Jason Foster fell and broke his hip, and his health began to deteriorate. 4 years later, he had a stroke and was taken to the Flinders Medical Centre, where he was to spend the last 2 years of his life. What's he doing in that one?
He's decoupage, which is
lovely.
That's decoupage.
Diane Badman was often frustrated by his care there and says his eventual death from a heart attack could have been prevented. And that's
lovely shot. Sisters. Very special, that one. He was last on the list, so to speak. Yeah. And he was denied physio. For a short while he received physio, then he was, in our opinion, deemed not worthy.
Judy Hurrell's sister Anne Brown died of cancer at the Flinders Medical Centre in 2017. Ms Brown had an intellectual disability after being deprived of oxygen at birth.
She loved books in her later years, and it was just lovely because I was a kindy teacher and I like reading, and so she really enjoyed those books.
When Anne Brown went to hospital, her family says she wasn't allowed a carer, and when Ms Hurrell rushed from the Eyre Peninsula to see her dying sister, she says hospital staff tried to stop her.
They didn't understand little things like when she pulled at her hair, that meant she was in pain. They wouldn't know that. Also, they thought she was non-compliant. Well, that was probably because she didn't understand the instructions.
The treatment of Anne Brown and Jason Foster were examined by an investigator who looked into a total of 7 cases of alleged discrimination against people with disabilities in South Australian public hospitals. The ABC understands that report was handed to the state's Health Complaints Commissioner 2 years ago, but it's never been made public, and even the families involved are still in the dark.
It has not been released, and that's very disappointing.
I haven't heard anything for 2 years since then, and it sort of is in the back of my mind, well, maybe nothing's changed.
While his predecessor planned to release the report, the current Commissioner, Grant Davies, has told the ABC that's not appropriate, in part because the nature of some of the matters raised are distressing. He says he'll release a summary in the near future. There is other evidence that people with disabilities don't get the same level of treatment as those without. Professor Julian Troller from the University of New South Wales compiled a report into preventable deaths for the NDIS.
The person may not have their distress attributed to pain, it might be attributed to the disability itself, and this might lead to misdiagnosis. And there are certainly many instances where this has occurred with tragic outcome.
In New South Wales, he found 38% of deaths of people with disabilities were preventable, more than double the rate in the general population. And his studies found that people with disabilities die on average 27 years younger.
So these are simple things that we could address, but we need to ensure that all staff have mandatory training and that all health systems are equipped.
While it's too late for Jason Foster, his mum thinks change is needed so others don't needlessly suffer.
There's never a day goes by without we think about Jason. How different life would be if he was still here. He's a lovely boy.